Okay, so first thing I'm going to do is I'm going to gather my supplies. So I have here is my alcohol, I have here my medication, which is diamond hydronate. I have here is my syringe to withdraw the medication, my mini bag, which is right here. I have my medication label, and I have my secondary line, and here's just the MAR, which is just a blank piece of paper just to show you. So now I'm just going to be looking at the MAR with the medication just to ensure that this patient is not allergic to diamond hydronate. So I see that they're not allergic, which means that we can proceed. So now I'm just going to look at the medication to make sure that we have here is the right name, so diamond hydronate. We have the right route, which is IV. We have the right dose, which is 75 milligrams, which is equal to 1 milliliter. We have the right time, which is 11 o'clock. And then we have here is the right patient. So now that I have that, I'm just going to be doing my first check against the MAR. So I'm just going to be ensuring that it's the right medication, so diamond hydronate. I have the right route, which is IV, and I have the right dose, which is 75 milligrams, which is equal to 1 milliliter. So now that I have that, I'm also just going to be checking the expiry date now that I'm here. So I see here is diamond hydronate is expiring in December 2019, which means that we can use this. And then also the mini bag is expiring in 2020, which means that we can use this as well. So now that I have all that done, I'm going to be calculating my infusion rate. So I have here is 75 milligrams. I'm going to multiply it by the drip factor, which is 10, and I'm going to be dividing it by 30 minutes. So that will give me 25 drops per minute. So now that I have that, I'm going to be assessing the arm right here just to ensure that there is no redness, there's no irritation. And then I'm just going to clean up this whole working environment, make sure that everything is clean and not in the way. So now that I have that, I'm going to do my hand hygiene, washing my hands. And I'm going to be doing my next check. So I'm going to be checking with the medication again, just against the MAR, just to make sure that I have the right medication name. So diamond hydronate, I have the right route, which is IV, and I have the right dose, which is 75 milligrams. So now that I have that, I'm just going to fill out my medication label right here. So I'm going to be writing on the medication label the patient's name. I have here is that my name because it's been added by me, the time, which is 11 o'clock, the medication, which is diamond hydronate, and the route, which is IV, and then also I'm going to be writing the dose, which is 75 milligrams, which is equal to 1 milliliter. So I'm just going to place this over here for now, and then I'm going to get ready to withdraw the medication. So I'm going to clean this, just the top like this, and I'm going to withdraw the, I'll clean this as well, just so it's already prepared. And then I'm going to withdraw the medication, so I'm withdrawing here 75 milligrams, which is equal to 1 milliliter, so I'll be withdrawing 1 milliliter. So I'm just going to withdraw the air here, out 1 milliliter, and then I'm going to inject the air into here, and then I'm going to be pulling out 1 milliliter, and I'm just going to make sure that there's no air bubbles here, which I see that there's not, so this means that this is okay to put in. And then I'm going to put it into the mini bag. I'm going to throw this out into the sharps container. I'm putting this into the sharps container, and then I'm just going to gently agitate the mini bag just to make sure that all the medication is infused. So now that I've done that, I'm going to be putting the label on. And I'm going to be doing my third check. So with the third check, I'm just going to look against the MAR now, and I'm going to make sure that I have the right medication, so diamond hydronate. I have the right route, which is IV. I have the right dose, which is 75 milligrams, which is equal to 1 milliliter. I have the right time, which is 11 o'clock, and I have the right patient's name. So now that this is good, everything that I don't need is going to be putting it in the garbage, and now I'm going to be going to the patient's bedside. So I'm going to introduce myself. So hi, my name is Anna Sideropoulos. I'm a year 2 nursing student, and today we're going to be administering diamond hydronate through your IV. Is that okay? And then they're going to say yes. And then I'm going to ask to see their wristband, and I'm going to say, can I have your name and date of birth, which is 2 patient identifiers. And then I'm also going to look at their wristband with the MAR just to assess for any allergies and make sure that everything okay. And then I'm going to do my final medication check against the MAR just to ensure that we are able to administer this medication. So I'm looking for the right medication, so diamond hydronate. I'm looking at the right route, which is IV. I'm looking at the right dose, which is 75 milligrams or 1 milliliter. I'm looking at the right patient name and also the right time, which is 11 o'clock. So now that this is ready, I can proceed by going to hang up the mini bag. So I'm going to hang up the mini bag and make sure that it's higher than the primary line. And now that the mini bag is here, I'm just going to cleanse the port up here, just to make sure that everything is clean and there's no problems that are occurring. sorry, I'm going to clean this first, actually. And then I'm going to pull this thing out. And I'm going to clean this port before I aseptically spike it. And then now I'm just going to be aseptically spiking the mini bag. And then I'm just going to open the clamp now just to ensure that it is, the fluid is filling just until it gets to the tip, and this is going to prevent any problems from occurring. So I'm just doing that. Okay, so I got it now that it's at the tip. Everything is okay here now. So now we're able to actually attach it to the primary line. So I'm just going to clean this port. And I'm also just going to clean this port just for safety reasons. Okay, and now that this is okay, I'm going to be calculating the drip rate, which is 25 drops per minute because we already calculated that. So I'm just going to wait for a minute. Okay, so now that we have 25 drops per minute, this is okay, and everything is normal. So I'm just going to go and document now into the MAR, and I'm going to document the medication that we gave, so dimenhydrinate. I'm going to document the time, 11 o'clock. I'm going to document the route, which was IV, the dose, which was 75 milligrams, or 1 milliliter, sorry. And then I'm just going to, I can also go into the room just to ensure that there's no adverse effects of the medication, and I'm done.